Hi, it's Mike Keenan from KM Fitness. I'm here today to invite you to our next webinar. It'll be next Tuesday night, the 18th of March at 8 o'clock. It'll be Cholesterol Truths and Myths. And one of the things I'm going to be talking about is something called Syndrome X, also known as metabolic syndrome. And I want to give you a rundown real quick of some of the risk factors that are associated with that. So when you meet with your physician and he says or she says that you have Syndrome X or metabolic syndrome, you'll have a better idea of what they're talking about, what parameters that they use. Okay? The first thing is if you have 3 or more of these symptoms, you're classified as having metabolic X or metabolic syndrome. First is triglycerides greater than 150. Second would be an HDL level. If you're lower than 40 for men or lower than 50 for women, then that's another risk factor. If your blood pressure is over 130 over 85, or if you're on medication for hypertension, then you qualify as having that risk factor. If your blood sugar, fasting blood sugar, is greater than 100, or if you're being medicated for type 2 diabetes, then you also qualify as having that risk factor. The next one is BMI. BMI greater than 30. Okay, BMI isn't always the best predictor. I'll give you an example of that. If you play for the New York Jets and you're 6'2" and you're 240-pound linebacker at 15% body fat can run like the wind, BMI isn't really a relevant marker. But in the case of most people, BMI would be. So if your BMI is over 30, or if you have a waist to hip ratio greater than 0.9. So in other words, if your waist is bigger than your hips and you're a man, then you definitely fit into that profile. Or if you're at 0.85 for women. Or a waist circumference of over 40 inches with men, 35 inches with women. So these are some of the risk factors that your physician is going to be looking at when deciding on what your best course of treatment is. The other thing I'm going to be talking about, we've had a lot of controversy with this, is how do statin drugs affect your cholesterol? Should you be taking them? Shouldn't you be taking them? Well, that's up to you and your doctor. I'm just going to present the research. I'm going to tell you what the literature is telling us with regards to some of the advantages and pitfalls of taking statin drugs and how that all fits together. So hopefully we'll see you next Tuesday night at 8 o'clock. See the link below and you can go ahead and register to be part of our audience. Take care. Have a great day. Bye-bye.